Welcome back to the podcast. And this week, we are taking a moment to talk about something really important. So, how to get started working with us. So, whether you are dealing with fertility challenges, hormonal imbalance, or chronic health, we are here to help. So, here we are. We're going to talk about it. And I have Dr. Erin, as usual, gonna be with me during this process, trying to explain what do we offer and how can we help you. Welcome back, Dr. Erin.
Hello, thank you for having me today.
So we know that healing journey, people talk about healing journey, but it's deeply personal. And being an acupuncturist, we tailor every service that we have, right, based on individual needs. So can you talk about what you offer, Dr. Erin?
Sure. So, like Dr. Pamela, I'm actually a doctor of acupuncture and Chinese medicine. I'm not actively running a clinic anymore, though. So, I left the acupuncture practice for a while, just for my own reasons. And so now, for the last year, I've been cultivating working online with people and doing telehealth services. So I do all the same things I always did, just without the needle part. I do the Chinese herbs that people love, which almost all my fertility patients end up on Chinese herbs. I like to do nutritional evaluations. I do a lot of blood chemistry with people, looking for underlying conditions, reasons for inflammation, things that validate what we think is already going on. And then I do a lot of coaching with my clients. I work with them more in the talk space. The longer I was in clinic, the more I realized a lot of people came for acupuncture and a lot of people came to talk. They needed somebody that they trusted, that was knowledgeable, that they could have a conversation with about things. So those were the pieces that I really wanted to bring with me in this next part of my professional life. So those are the things that I focus on with all my clients.
Perfect. So in my case, I'm actively running a practice. So I see patient one-to-one and I perform acupuncture treatment. But the reason why I feel like me and Dr. Erin complement each other is basically the collaborative effort. So like Dr. Erin said, most people that come see us, they want to talk. They want us to listen what they are experiencing. But the thing is, when you with me, you only have 5 to 10 minutes to talk about it, and you basically have to get your treatment. You in bed and at least for 30 minutes. So the reason why, if you're gonna work with us, right? Get somebody, like they said, it takes a village. So when you come see me, you get the acupuncture treatment. But at the same time, but if you want to explore more on, you want to talk about it more, that's when Dr. Erin comes in. So I'm going to give you one example. So Dr. Erin and I share a patient, a fertility patient. So this patient loves both of us because we taking care of the physical part and also the headspace. So she called Dr. Erin the nutritionist acupuncturist. So the things that she was not able to discuss in clinical setting with me, she can talk about it in with, right, Dr. Erin?
Yes. And that's like, it's intentional to make that time and that space and be able to help people. There's so many questions in fertility, and it doesn't matter if you're trying to conceive naturally or doing IV, it doesn't matter. There's a lot of information on the internet. We always say there are a lot of things that are good, but is it good for you right now? And that's a big part of what I do with my clients is help them parcel through all the information they've already collected because they've already read a book and they're following somebody and they bought this stuff. And then we have to decide, is that even what you need? Or do you need something else entirely? And patients love to feel cared for. So the dynamic between the two of us, just knowing that I said, hey, I talked to Dr. Pamela today and she told me blah, is already like, oh my gosh, they're really taking care of me here. And it's really empowering to a patient or a client to feel cared for in that way. Someone's really paying attention. So patients love knowing that they've got two heads working together. So anytime we would have a conversation, I'd say, I'll follow up with Dr. P and I'll take it from there. And then I'd call Pamela or text her and she'd say, here's what I saw. Here's what I think you should add. And then we could really build this great collaborative team, even though we're not in the same space.
So it's no longer you just need one acupuncturist. You need one acupuncturist that perform the needling process because you only have certain amount of time to talk about it. But you have a lots of questions. You're not going to talk to your girlfriend about this because they don't have that knowledge. That's when you go see Dr. Erin. And the best thing about that, right? You can do this one all over the world. Can be on the other side of the planet. You can reach out to her. She can help you with that. But not for me, unless you're gonna come and visit me here. I'm in Navarre, Florida. So if you like being called to come and get treatment from me, by all means, I welcome you over here. But anyway, that's part of how we work. So tell us about the process, Dr. Erin. So if somebody interested working with you, what do they have to do?
First thing we do is just a call. We just do a consultation call. I ask them about where they are, what's going on in their world, what are they looking for? If they're already seeing somebody for certain services, what are the elements that I think I can offer? So that first call is about that. And then I help them decide, am I for you, or do you need something else, or whatever that is. I'm not here to hoard patients. I'm here to do my best for people that I think I can do it for. If that person's not for me, let's figure that out and I'll get you where you need to go. So it's a consultation call. And then we go with usually first step, health history. So we're going to get all the nitty gritty details, all the things kind of leading up to this. We set some goals. We obviously have a big goal, right? We want to have a baby, but there might be some other steps that we know we need to take care of on our way to that place. If you don't sleep good, let's take care of that. If you have crappy digestion, let's take care of that. So we're still working on the whole body, just like you are, Dr. Pamela, with acupuncture. The way to get to fertility is by making everything work really well. And then it's a little bit variable per person. I have some people, and I usually just ask them, how much hand holding are you looking for? If you're really emotionally distraught, we're going to need to talk regularly every week, maybe every 2 weeks. Most people, I set it up. We're just going to talk every week so that as things are happening and you're going through the different phases, you have somebody to call and say, I got bad news today, or this happened with my partner today. And it just becomes a real conversational piece in addition to, are you taking your supplements? Are you working on your diet? Those things. I can tell you everything to do, but it's whether or not you can take it in and make it meaningful to you that really is the outcome. So I know Pamela and I've talked about this a lot. We have a lot of patients that come in and they feel like they're doing everything, right? They read the book and they changed their diet and they've checked all the boxes. Why isn't it working? And that's because it's in the spirit. If you're just checking the boxes to be checking the boxes, then you're not representing the emotional component of that. There's all this stuff underneath it. So when we work through acupuncture and then when we work in this talk space, we really get to get into those deeper levels that most people don't really get to.
Excellent. So in my case, right, I'm seeing one-to-one patient. All right, the first thing you have to do, of course, you have to call the office, and then we schedule you for a 20-minute consult. So during the consult, right, just like Dr. Erin, so I'm gonna ask you what's going on, what is your goal, then I will evaluate, get all the TCM diagnostic, check your tongue, check your pulse, check your belly, and all of that, all the 9 yards. And then after that, we will decide if you are my patient or not. If you're just there to trying to figure out if it is right for you or not, that's fine. I'm not for everybody. If you feel aligned and you feel calling to work with me, you will know during the first visit. Then from there, I'm going to recommend how many times treatment, how regular you're going to be in treatment. So we can come up with treatment plan. And then the best thing when you work with me and Dr. Erin, so she's going to be taking care of the nutritional component. I'm going to give you here and there, very simple, but my focus is the needling part. So she's going to take care the nutritional part because this is the right hand and the left hand. That's what we are. We are your left hand and your right hand. So that's about it. And then we just have to follow up with your progress every week and until you reach your goal. You want to add anything about that, Dr. Erin?
You know what? I'm going to add this one thing. I was always frustrating, and you know this, when you're in the clinic it takes two people to have a baby, but very often only one of them is your patient. So most of the time, we're seeing a lot of women trying to get pregnant, and we're not seeing a lot of men who are also trying to get pregnant. And I think that's one of the best things about changing in this way is I have been able to really integrate partners a lot more in the conversational space. I just got off the phone with somebody and we had a call scheduled and they were traveling and they were on the call in the car together. And it's really nice to be able to address both partners equally, together, separately. And so now I just sort of integrate those in there because it takes two people. So you can be doing all those things as the female, but if you can't get your partner to do any of it and he doesn't know what to do, then it's nice to be able to say, we're just going to put him in the pot too. And let's get some feedback from him or whoever that person is. So I'd say that's the only other benefit.
Perfect. So it's just like clapping your hand just with one hand. So you need both of them to be there in order for you to conceive properly, right? So that's fertility part. So we also address various conditions with traditional Chinese medicine. So do you have anything else that you offer during the online calling, Erin? Hormonal imbalance, postmenopause, women. Tell us
Yes.
more about that.
All the above. I think women's health has always been my specialty. I see a ton of women. Half the women, I saw them in fertility, and now they're further down the road and they're having a gynecological problem or they're having menopause, or I've just been able to experience them over a lifetime, which is a really wonderful thing. So those are my primary focuses. Really, I will see men. If the male partner is the primary person, yes, absolutely, we'll work on that. But those are the biggest things. I don't do as much of the chronic disease as I used to. I've really gotten back into the women's health specialty.
Yes. So I'm the opposite side of that. I treat fertility cases, but at the same time, I'm good with any chronic condition. That's my thing. So I use lots of Maxa. Maxa is basically my magic wand. So I learned this one from my master back in Japan. So I share my knowledge with Dr. Erin as well. But the main thing that helps people chronic cases is the masturbation. So that's my specialty. So instead, not just like fertility cases, I treat children as well, middle age and elderly patients. In fact, this morning I have 8 years old girl that came see me for treatment. And I didn't go so crazy, just literally just meet the energy for that little girl where they at. So we're not scaring them with this needle. So that's how we work with acupuncture. We meet you where you at and then go from there. So before we close, before we end this call, do you have any unconventional tips, Dr. Erin, to start working with us for their healing journey, for patients to start with their healing journey?
I think number one is you have to be willing to take the advice. I can give it to you, but if you're not willing to take it, then we're not going to get very far. If you go see Pamela and she says, I want you to do this thing, and then you just keep coming up with reasons why you don't do that thing, then you're not facilitating on your end. And I think people mistake that. They want to put all of the emphasis on the provider. She's going to do this thing for me. She's going to do this thing to me, and it's going to work. And it's not really like that. The best relationships in any condition are coming from both sides. It's when the provider and the patient are doing the work together. So I'd say that you have to be willing to take what's given. I think you don't have to like the advice, you know?
Yes.
If you have a person that, like you said, who's running a marathon and training for an Ironman and trying to have a baby, they don't receive it well when you say, you really need to stop that. You have to slow that way down. They don't like it. It doesn't feel like who they are, but that doesn't mean it's not what needs to happen. So you have to be willing to take some tough advice. You have to be willing to take accountability for what needs to happen. So you have to learn how to be receptive, to listen from the heart, not to defend yourself and not explain yourself, but to just really listen. That's what Chinese medicine is. It's all of these opportunities to help us get back into the flow. We're so trained to go and to push and to climb and to strive and to persevere and all those things. And Chinese medicine's like, no, you're making it too hard. And people, they don't take that very well. It's the strangest thing when you tell somebody you need a break, that they're like, I can't have a break.
That's
It's
right.
unbelievable that you would say that. And they just blows their mind. But that's what Chinese medicine is. So come into it knowing that. Come into it being willing to say, okay, that's not my norm, but my norm isn't working, right? Your norm is not doing what it needs to do for you. So we do have to be willing to make some changes. So that's one big thing, but that's the best way to get through it.
So I just want to add something. Probably you already mentioned it. So working on the goal, right? So we want to work with you to get closer to your goal. So for example, right, you have a goal to receive pregnancy, but if you are doing something else, oh, I want to get pregnant, but you are not really putting the energy of getting pregnant, meaning you travel a lot. I'm sure this is part of the question that you have to ask yourself. Is it that important for you to travel a lot, do all this marathon, do this triathlon, and then you keep busy doing other stuff, and then basically the energy that left for you to reach your goal is just like this big.
Yeah.
So it get to the point that you just have to prioritize what really is that you want at this time of your life. So it's all about timing. And then you
Yeah.
can revisit that next time.
Like, you might be a marathoner for your whole life, but maybe
Yeah.
not for this next 2 years.
Yes.
You have to be willing to make the space. We do an exercise called making space for baby, and that's exactly what that is. What are you willing to change about your life to make space for this baby? Because if you have all your boundaries up and you say, well, and I won't do, well, then where does the baby even fit? If there's no place for it to even go, then how is that going to work? So when we start, reflecting on it, yeah,
Yes.
it's so much of it is just starting to help people go, oh, I just didn't even realize that, because we're trained in society to stay in productivity mode all the time, and it's fertility.
All right, everybody. So if you feel called to work with us, so I'm going to leave the information below. So check the link and then reach out to us based on the phone number or email. So we'll get back to you as soon as we can.
Yeah.
All right. So always, thank you so much, Dr. Erin, for this week conversation. I think it's very good. And then I'm sure we illuminate the pathway for others that need our support. Thank you so much.
Thanks.
And yes, and take care for now.
Bye.